Hello and welcome to Dr. Miriam's Nurturing Minds, Transforming Lives. Have you ever wondered why therapy doesn't always work, even when both therapist and client appear to give it their all? It's a question that many have asked, and the answers are as varied as the individuals seeking help. Consider the story of Norma Jane. She was a successful businesswoman struggling with perfectionist tendencies and anxiety. Norma Jane sought therapy, hoping to find relief. Yet after several sessions, she felt no improvement. The problem? Norma Jane's therapist was a poor fit for her. Their personalities clashed and their communication styles didn't mesh. The therapist's approach was too passive for Norma Jane's proactive nature. Now let's look at another scenario. Meet Roberto, an autistic college student battling depression. He began therapy with high hopes but soon felt more lost than before. His therapist used a one-size-fits-all approach, failing to tailor the therapy to Roberto's unique needs and circumstances. This approach overlooked Roberto's individuality, leading to a lack of progress. Then there is the case of Raquel, a young woman grappling with complex PTSD. Her therapist, while well-meaning, lacked the necessary understanding of her condition. This lack of understanding prevented the therapist from fully grasping Raquel's struggles, making the therapy ineffective. She focused on a diagnosis rather than on what Raquel needed. Then there was Noelia, whose need for therapy wasn't really hers. Therefore, she was not always transparent or honest during therapy. Therapy demands honesty and vulnerability. If a client isn't ready to acknowledge their challenges or are resistant to change, the process becomes challenging. Denial, lack of awareness, fear of confronting difficult emotions can hinder progress in therapy. Another client-related point is motivation. Therapy works best when the client is self-motivated. However, if someone is attending sessions to please others due to court orders or societal pressures, they might not be fully engaged. Therapy isn't as effective when it's seen as an obligation or as a means to satisfy external demands rather than a personal journey of growth. Next, consider the story of Keith, an older gentleman dealing with grief. His therapy was moving at a pace that was too fast for him. The therapist, eager to see progress, pushed Keith before he was ready. This rushed pace made the therapy more harmful than helpful. Lastly, remember Leandra, an artist wrestling with bipolar disorder. Her therapist used a unimodal approach, focusing solely on CBT. However, Leandra would have benefited from integrative therapy, carefully incorporating elements of person-centered therapy, compassion-focused therapy, CBT, medication, and lifestyle changes. The lack of adaptation in her therapy left Leandra feeling stuck and misunderstood. What do these stories illustrate? That therapy can fail when there is a wrong fit between the therapist and the client, when a one-size-fits-all approach is used, when the therapist lacks understanding or adaptation, when the needs for therapy are external to the client, when the pace is wrong, and when a multimodal approach is needed but not implemented. Therapy, like any other form of treatment, is not foolproof. It requires the right fit, a tailored approach, understanding, correct pacing, and adaptation to the client's needs. When these elements are missing, therapy may not yield the desired results. It's important to remember, however, that these are not reasons to dismiss therapy altogether. Instead, they should serve as reminders of the importance of finding the right therapist, the right approach, and the right pace. In conclusion, therapy can be a powerful tool in addressing mental health, but it's not always a straightforward journey. Recognizing the potential pitfalls can help individuals better navigate their therapeutic journey, ultimately leading to more successful outcomes. To understand more about integrative therapy and other mental wellness-related concepts, please visit us on drmiriam.co.uk. If you enjoyed this video, don't forget to like, subscribe, and share.